And as the day wears on, the tension builds, with another tiny dinner of chicken curry and rice for Dawn.
I don't know how you eat this. I really don't. It was disgusting, was the word for the brown rice.
I don't know how you eat this.
Whilst for Charlene, it's Dawn's favourite, noodles, chilli and melted Stilton.
So I feel that they've kind of misrepresented the amount of vegetables that Dawn eats, because I'm looking at the foods that she's eating and I am seeing some vegetables here and there. They kind of said basically all she eats is meat. That's not true. There is, I'm looking at what she's eating now. It seems like there's tomatoes in it. It seems like there's onions, there's various things. And at lunch, she talked about picking the tomatoes out and eating them. So there are some vegetables she's eating, because I was really genuinely wondering how this woman didn't have scurvy, the way that they talked about her diet. But as I'm looking at it, I'm like, no, like there's some vegetable matter in what she's eating, right? It's not totally devoid of vegetables. So they really have a penchant for exaggerating as well.
How can you have just this little? There's nothing here.
The amount of cheese you put in the blue cheese is it's probably very fatty compared to the other types of cheese. The taste of it is just really sickly.
And the endless excuses really start to get Dawn's back up.
Have you finished with that now?
Yeah.
Because that has not even been touched, really. What did you think was going to happen when we come here? You knew you were eating my food, didn't you?
Yeah.
So why aren't you eating it?
I am eating it.
You're not, though. It's a diet swap.
I'm glad she's saying that.
And I'm playing my part, but you're not playing yours.
She's saying literally what I just said, which is that there's a disproportionate amount of commitment that we're seeing here to the exercise, right? I can see why that's really frustrating. Also, I would like to comment that I see other additional vegetables in what we're seeing right now. So I see some carrot, for example. I see some kind of dark thing. It could be some kind of green, like a spinach or something, or it could be the inside of a mushroom. There is tomato. I'm seeing vegetables in what she's eating. So there was definitely some exaggeration around that, for sure.
Can you put on my plate what is a normal size portion? So why didn't you eat that amount?
Because I couldn't. I did try the mince, despite the fact the smell of it really, really put me off, and I still didn't like it.
Charlene seems to be really resisting the diet swap. Whilst I appreciate that Dawn's portions are enormous, Charlene just isn't making enough effort. The meat in Dawn's diet will provide iron that Charlene is so badly lacking.
It's nice that he's talking about exactly what Dawn just said, where there are things in there that she needs and she's really resisting eating. I think that's pretty validating to what Dawn was saying. And I think it's true. She needs stuff and she's just not really getting much in her tummy, which is really sad.
And it'll also give her some much needed energy, so she has got to start trying harder.
With Charlene in denial about her issues with food, Dr. Christian sought reinforcement from home.
Dearest loving Charlene, hope you are doing well and not missing home too much.
We hope you're increasing your portion sizes and finishing all your meals. It would be nice to see you with... It would be nice to see you with a bit more of an appetite. We do worry about you, especially when you don't want to eat or just sleep.
Lots of love and God bless.
The letter from home clearly had a big effect on Charlene, but the question is, will it make a difference? They're both back to their old trick.
What is that?
Deep fried duck eggs. Look at that. That is just superb.
I'm satisfied.
Do you find this really, really greasy when you eat it? I don't think there's any joy in the duck's eggs. I find your breakfast always so salty. And I'm not used to the salt, and then it's like eating teaspoons of salt.
Yeah.
Do you add the salt in your bacon or not?
No, not at all. No.
Is it salted bacon then?
No. Best not to think about it then. Best just to get it down the neck.
really, really full now.
Although Dawn is sticking to Charlene's diet, it's clear she's still missing fatty foods. To ensure she stays on track, Dr. Christian has a message to show her from the States, a vision of her future.
I'm Christina Robleski. I'm 40 years old, and I'm about 43 stone. You just don't realize that it's going on until it's too late. Back in 2006, I began noticing some health issues. We're diagnosed with cellulitis in the leg. Then we're diagnosed as diabetic, and I'm diagnosed with high blood pressure. About a year, 2 years ago, these little blisters would come up, and they itch really bad. Those are what's commonly referred to as diabetic ulcers. When you're diabetic, you're more prone to getting these things, and they're very difficult to cure. I don't want this pain. I don't want all these health problems. But once one thing starts to happen, it seems as if it just continues and it...
I'm going to finish this section. I needed a breather. I'm going to finish this section and then comment on it as a whole, because I don't want to have to come back to this. This is many levels of bad.
It seems as if it just continues and it continues, and it's a vicious, vicious cycle. Without my husband and my son, I don't think I could make it. I don't want to die like this. Dawn, you're heading down the pathway that I've already been down. And I'm asking you from one woman to another to live for yourself. You've got that opportunity to do something now. Don't wait.
Okay. First of all, the idea of having somebody who is fat basically try to scare somebody into changing what they're doing is sort of like your scared straight strategy. And we know that that does not work. We know from years and years and years of like drugs education on like in schools for children. We know about all sorts of stuff around incarceration. It just, the scared straight thing does not work. And I think, you know, that is essentially what they're trying to do here. They're trying to show such an extreme example of somebody who's having terrible health problems who is fat to this lady who's fat and trying to get her to stop being fat, basically. I think like there's a big disconnect between, like, the assumption here is that this lady is fat because of her eating choices. She is unhealthy or going to be unhealthy because she is fat. So therefore, if she eats different, she will not be unhealthy. That's sort of the logic train here. We actually know absolutely nothing about the woman in the video. We know nothing except the size of her body and her health conditions. We don't know if she was leading an active life. We don't know if she was eating tons of nourishing foods or if she was eating foods that are not as nourishing. We don't know anything about her lifestyle, anything about her choices. We just know that she got fat and she got sick, right? Literally, I just earlier in this video talked about how there are lots of things. The example I gave was insulin resistance. This lady's diabetic, that will cause fatness at the same time that it will cause an increased risk for diabetes. When we have somebody who we have no idea what choices they're making in their lives to improve their quality of life, to make their bodies feel better, to care for their bodies. We don't know if this lady smokes. We don't know if she drinks, 10 beers a day. We don't know. Like, there are so many factors in our health choices and in our food and drink and whatever choices, our physical activity choices, all of these different things that can affect outcomes for our well-being. We know none of that for this lady. So he's saying, hey, look at this lady. She's fat and gonna die. Look at you. You're fat and gonna die. But there's actually no confirmation here that we're not completely comparing apples and oranges. The result is supposed to be Dawn saying, all right, I'll change the way I eat. When we have no evidence at all that the lady in the video didn't just have this really bizarre mutated gene that made her really fat and maybe she eats great and she, we have no idea what her diet is like compared to Dawn's, I would agree that there's some room for improvement in what Dawn is eating, but it's not nearly as bad as they described in the first. They made it sound like she had never seen a vegetable in the past 10 years. That is absolutely not true. And I think like the more that we do this sort of fear mongering, the more we reinforce this idea that fat people are just like idiots, right? We're just idiots. We're just like making terrible decisions. It couldn't be that we're prone to being fat. It's just that we're making terrible decisions. We've brought it all on ourselves and we're too dumb to not do that. It's so bizarre to me. Like, as somebody who is a fat person and who is very intelligent, I'm not afraid to say, and as someone who knows tons of fat people who are very intelligent, the idea that fat people are treated like idiots who just don't know better, like that the answer is obvious and we just aren't following it, is absurd. And I think that the more that we reinforce this idea that fatness is all about what you put in your mouth and that it's really simple, all you got to do is not eat X, Y, and Z or whatever, like the more we reinforce that, the more we place blame and shame on fat people, many of whom are making good decisions, but we see that a lot of bodies are very diverse. Some bodies are very prone to becoming fatter and some bodies are not. It's not helpful. And this sort of fear mongering is actually really inappropriate. And I feel terrible for the lady who is in the video essentially being exploited because they want to have some kind of shocking thing to show the woman on the show to try to scare her straight. It's incredibly inappropriate. It's really upsetting. I had to take a break halfway through that video because it was so upsetting. I just feel it's incredibly inappropriate and flies in the face of all of the stuff they just showed a few minutes ago about disorders that need serious treatment. Here, it's not that there's any kind of disorder happening. It's not that she needs any kind of treatment or support. It's that she's just too much of an idiot to make good choices for herself. It's patronizing and it's inappropriate. And I just don't know how to reconcile this stuff with the entire segment on eating disorder treatment. Like, I just don't understand how they have these two things coexisting in the same show. Let's continue.
Gosh, I've always worried about diabetes because, you know, the diabetes has obviously been a major health factor with her and it's so reliant on other people.
And to hammer home this message and encourage Dawn to stick to the diet, Dr. Christian's keeping up the pressure.
You're going to be flying out to America to go and spend some time with that lady.
Gosh.
How do you feel about that?
Well, quite upset that I'm going to meet her.
You've both got the same health risks.
Yeah.
It's just that hers have happened and yours are waiting to happen.
Yeah.
I want to know what the evidence is for that statement. You've got the same health risks, just hers have happened and yours are waiting to happen. Citation needed. What are the similarities between them except body size? We don't know.
She doesn't want me to be like her. And I do not want to be, in 10 years' time, making that movie for somebody else.
It's day 3 in the feeding clinic, and you could cut the atmosphere with a knife. For Superskinny Charlene, dinner tonight is the mother of all roasts, with chicken and stuffing, pork, beef and 5 roast potatoes, followed by cheesecake and chocolate biscuits. While for Supersize Dawn, it's broccoli and brown rice. Again.
How do you even call this? How does that meal taste?
I don't want to be rude, but not very pleasant, to be fair. I mean, you've moved that spud around 4 times now, Charlene. Why do you think you do that?
I don't know.
Just eat it. This is killing me to sit here while you arse about with food and play with it while I'm sitting here starving hungry. After that.
It's easier for you to like gobble up stuff because you're used to it and I'm not.
It's not easy for me to starve though, is it?
I think because she's hungry and she's getting really like crazy psycho.
Charlene just called her psycho because this woman is living on a thing that any normal person could not live on. I think Charlene's attitude is getting to me as well. I try to be patient with people. I am myself losing my patience with this woman.
It's like talking to a toddler. Don't play with your food. Put it in your mouth. Put a bigger spoonful in your mouth. Don't take an hour and a half, 2 hours to eat your dinner.
It's making me feel really, 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 really full. My tummy sticks out.
Despite a letter of support from her mum and Dawn's frustration, Dr. Christian feels Charlene is still not embracing the diet swap and decides to step in.
I'm not sure we've cracked you yet on the eating front. I think you're still being very resistant. You're not eating enough, are you? You still haven't finished a whole meal. I need you to show me that you can eat more. You're not going to vomit, you're not going to be sick, the food is not going to do anything horrible to you. In fact, it's going to do you a lot of good. You're lacking iron, you need that meat for these last few meals that you've got. Just really go for it. Surprise yourself, surprise me.
Okay.
All right?
Yeah.
Okay, come on in.
Although Charlene shouldn't be eating meat to the level Dawn is, it does provide many nutrients vital for a healthy body, including protein to aid muscle growth and repair, iron to make red blood cells which carry oxygen around the body, and vitamin B12, essential for a healthy nervous system and releasing energy from the food we eat. This week, Ursula is helping our group with eating disorders confront their body dysmorphia by having plaster casts of their torsos made. Acknowledging what they're doing to their bodies is an important part of their recovery. Earlier, Erin fainted while standing for her cast, so dietitian Ursula has decided that it's safest if the rest of the casts are done lying down.
I don't like seeing my body. I certainly don't want anybody else to see it. At the moment, I can't imagine myself bringing myself to look at it. You lay there just for a moment while we...
I don't feel as though I have body image distortion. I know I look bad.
Just have a look. Just open your eyes and have a look. You don't want to look. What would it mean to look at it?
I'm not saying much here because I think this is some of the better content in the show, honestly.
This is going to be sickening.
Take a deep breath and just have a really quick look.
Finally, Emma sums up the courage to have a peek.
Yes, how I expect.
It's how you expect. Emma is someone who's extremely self-critical. Seeing the damage that she's done to her body, I think she found just unbearable.
I desperately want to get better. I've got plans for my future. I can't do it like this.
And lying down, Erin manages to complete the casting.
I think it'll just be really good to see how I actually look rather than what I think I look like.
But for Erin, who has particularly low self-esteem, being forced to confront her own body is tough.
What's your initial thoughts?
I feel disgusting.
Being able to walk right around it gives you quite a different perspective on it.
That's quite important because then you don't see what other people see if you look face on in a mirror.
No, you don't.
When I was younger, I used to just think about all the different plastic surgery procedures I needed to make myself look good. And then I thought, there's no way I'm having plastic surgery. I end up anorexic and I still hate my figure. If not, I hate it more than I ever did. I don't just have small boobs, I've got absolutely none at all.
Overall, it was quite distressing for her. She's somebody who has very low self-esteem, very low self-image, and it evoked lots of strong negative feelings with Erin.
For Mina, there is a particular concern about the body casting.
I look in the mirror and I'll look directly at my stomach because that's the bit I don't like.
Something I wish they explain more explicitly in this section is, so this is an exercise I think they're doing to combat body dysmorphia, which is when you stand in the mirror, you look at yourself, and what is actually there is filtered through a lens in your mind that sees you in a way that you are not actually. So if you're very, very thin, you might look in the mirror and see someone who's very fat. If you have really curvy legs, you might see someone who has really like thin legs that you would see on like a prepubescent person or something, and you might think, oh, like I look skinny and gross or whatever. You know, it's sort of like this distortion that happens in the mind of a person when they're looking at themselves through a very subjective lens, right? Because they're very critical of themselves. These girls she's talking about how they have really low self-esteem and stuff like that. This is not an exercise for people who have a realistic idea of what their body looks like normally, I would think, which I believe the first lady, Emma, I think was her name, when she said, I know what I look like and I'm very upset with what I look like. It makes me feel that maybe that was unnecessary for her. So I can see it with people who are maybe like seeing something different than is actually there and sort of being like, oh, okay, that's really what I look like. I guess like I need to work on sort of this distortion in my mind or whatever. I don't know what the treatment is for that exactly, but I can't see a lot of value in forcing Emma to do that when she had a pretty realistic idea of what she looks like. So I wish they would talk a little bit more about that piece specifically in this section. Overall, I think these parts with the treatment for the girls is actually some of the best stuff in this show.
Mina used to suffer from anorexia and weighed much less than she does now. She tends to avoid mirrors, so this will be one of the first times she's had to face her fuller figure.
Bloody hell. It does look really wide, and I know I was lying down. I just felt that I looked a bit fat, especially around the thighs.
I think that people are just not used to seeing normal bodies on display in this way, because so often, you know, in magazines and in different sculptures, you have these extremely thin bodies, and actually that's quite a normal, curvy female body.
I know you're right, but at the same time I think, oh God, I just want to lose a handful.
Mina is somebody who's spent years and years of her life being extremely underweight. Therefore, seeing herself as somebody of normal weight, she found quite shocking, and she interprets that as being quite fat.
Obviously, I'm comparing my body cast to the body cast of two anorexic people, so it's good that it's bigger. But I know I never want to be incredibly thin again.
The point of today's challenge and seeing the body casts was really to help the girls to explore their relationship with their bodies. Whilst Mina has almost come to accept her slightly fuller figure, both Emma and Erin have found it really tough. And I think all three girls have got a long way to go before they can accept and care for their bodies.
So just to kind of go full circle with that segment, I do think that one of the most valuable things that she was able to do with them is that she explained to them how squarely they fit into perfectly average framework of thinness if they are close to Mina's size. I think Mina's the name of the last girl. I think that's probably the most beneficial thing that she was able to get out of that. The other two girls just really seemed a little bit like shell-shocked. It was not clear to me what the benefit of doing that was. So I think there might be some room for exploring that and explaining that a little bit more.
Back at the diet swap, we've asked Dawn and Charlene to go through some old family photos to pinpoint where their own bizarre eating habits started.
Here we are again, like performing personal deep trauma on like television. It's just so exploitative. I don't like this stuff.
And they jolt some painful memories for Dawn.
If we go right back to the beginning of my childhood, both my parents are alcoholics and food wasn't available. There was very little of it. I mean, I knew what hunger was then.
When you feel like you're starving, is that a scary thing to you? Like before you started to stop on the first day, did you think, oh no, it's scary, like not?
Yeah, I did. I haven't felt hungry sort of from here.
Yeah.
First ever time.
Yeah.
When I got to working, food was like a world had opened up to me.
So whereas before you didn't have control over it,
yeah,
and now you could put your finger on it.
This woman's describing something that's very understandable. This is trauma around food insecurity. She has trauma around food insecurity, so now she's like, let's stock up. Let's express my control over food, because at the time I felt like I was not in control, like I was at the mercy of parents who are clearly not providing for me. And so this makes a lot of sense. Like, I'm not a psychiatrist, a psychologist, a therapist, any of that stuff, but this makes a lot of sense. It's like A plus B equals C. Like it just makes so much sense in my mind. Even though, as I say, I'm not a therapist or like a professional or anything, but it just makes a lot of sense.
I've realised where my eating to survive turned into an obsession. I mean, my mind sticks with when I was a child, when I didn't know when I was going to get food.
And for Charlene, it's a chance to understand her fear of food.
When you were very small,
She was so cute as a baby. That picture of her just like laughing is so cute. And then she becomes such a serious child so quickly. She seems like a very serious woman in a way that Dawn doesn't. It's interesting how Charlene is so different personality-wise.
A lot, she'd be like, oh no, don't eat too much of this. It's going to make you sick.
Is it a fear of how you'll feel? Because you obviously don't like feeling sick, do you?
Yeah, I don't want to have a feeling where I've eaten so much that I throw up.
Yeah.
That's kind of scary.
So you're actually stopping the intake?
Yeah, exactly.
How old are we here?
Probably about 19, 20.
Right. You're putting on a bit of weight there, almost. Don't know.
That's interesting that her parents were cautioning her against eating when she was really young, and now they're like, please eat, like we're concerned. To me, that suggests that maybe there was a bit of responsibility that her parents need to take about the way that they taught her to think about food. Those things are really hard to undo when they get really impressed on a small child. That's tough.
Because slim.
I think because then it was when I started uni and stuff, and I just kind of eat whatever.
You've started to get thin again. There's quite a big difference between that, and your face has definitely gone a lot slimmer there.
Yeah.
It starts to kick, the obsession with how you look.
Yeah, I would say it's more like recent, if anything. Yeah. I analyse things a lot, but it's become like automatic. It's not like I'm gonna have a packet of crisps. I won't be able to like just eat them and not think about it. Yeah. I've learned that things that I may have feared when I was little, I can take more control of, like try to eat more and then see how it is, rather than just like be so fearful that if I eat too much I'm going to be sick.
It sounds like Charlene is finally accepting she needs to eat more.
Chips.
Yeah.
But the proof's in the pudding. Time for the final meal. On the lunch menu for Charlene is fish and chips with a side serving of fried chicken and fatty pork belly, whilst Dawn's got a sandwich and a biscuit for Pud.
This is really nice. I'm very impressed that you're eating the belly pork and you've actually gone for that first.
What I've realised is it can have like some of your foods and not think, oh no, if I have this once in a month, something's going to happen.
It takes a lot to get my size. Day in, day out, eating.
I hope that I'd be able to eat more food without stressing or having like some sort of panic kind of, or like fear about it, I'd say.
Because I fear being hungry, you fear being full.
Yeah.
She summed that up really well. I fear feeling hungry, you fear feeling full. Like that's exactly what's happening here. Dawn is very bright. She's picking up on this, right? Yeah.
It's not a clean plate, but Charlene's eaten more than ever before, and she's even managed to polish off 2 whole chocolate eclairs.
Well done.
It's finally time for Dawn and Charlene to check out of the feeding clinic, armed with tailored healthy eating plans from Dr. Christian.
I think the most positive thing that I'm going to take away from this week is the fact that I can actually eat more and I don't need to think about the content of the food and analyse it.
I'm feeling really good now it's the end of the swap. I've got so many tools that I can use to resist food, to actually stop shoveling it in and actually take time to eat it.
So I'm pleased to hear both of them talking about their takeaways in a way that seems like they've really learned something about themselves, and that they have like a plan for the future where they feel like they can have more control over that in a happy, liberating way. At the same time, I kind of asked myself, like, where did that come from though? Because that seems like the kind of conclusion you draw from getting actual treatment for an eating disorder, which is not at all what they've shown us in their journey. They've just shown us basically the most salacious bits about them each not liking each other's food, and this weird swap that is kind of irresponsible, honestly. And I just think that what it does is it creates this idea that they drew these amazingly insightful conclusions from this really irresponsible exercise that they were put through. And I just am really not sure about that. So I don't know.
Coming up, Dawn hits the US and experiences the harsh reality of life when you're 43
They're sending
stone.
her to friggin' Louisiana to meet. So I'm all for building fat community. I hope they become friends and bond. That's great. But the idea that they're flying this woman out to meet this other woman who, we have no idea if they have anything at all in common except they're both fat. And then they're saying, yeah, this woman's terrible outcomes are going to be yours just because you're both fat. There's a big logical leap there.